I mean, I would talk about that TMS is the most innovative and new treatment for resistant depression that we have. And it is an effective treatment, and it has minimal side effects. And we now have a large population of patients who are not being adequately treated. And we will have an option to be able to treat these patients who haven't either responded to antidepressant medications or have had intolerable side effects. All right, when we take a look at pharmacologic treatments for depression, a lot of times what we see is that there's limitations due to the fact that the medications have significant side effects. And with those side effects, patients are often not compliant on their medications. Also, there's issues of efficacy. In some of the more leading studies, such as the STAR-D study, you found only 28% of patients got into remission of symptoms. So we really do need additional treatments for depression that we don't have, and TMS is now a new and effective treatment for depression. I mean, I would look at this and say that we have a treatment for depression that only a psychiatrist can do. And it's also an innovative treatment. And one of the things that I personally have a lot of passion is that we can actually do a treatment for a patient, and it's a procedure that you can have a close relationship with a patient. And you see these patients often day in and day out over 4 up to 6 weeks of time, and you develop a real rapport with those patients. Also, you got to put your entrepreneurial hat on. And as an entrepreneur, you have to say, well, what's out there right now for me as a psychiatrist to help patients, and also me as a psychiatrist that can benefit patients, and also the business model that's out there as well.
Nice.
Well, I think the first thing that you have to do, it's all about the patient. So I always believe that in psychiatry, therapy begins as soon as somebody has the first contact with your practice. So it's the first phone call. It's the first time they enter the office. We want patients to feel relaxed. We want them to feel comfortable. We want to get back to them very quickly. We want to answer all their questions. We want to give them information that they can use in order to be able to make their decision as far as whether they should utilize TMS or not. So it's every one of our staff has been educated about TMS, and they've been educated about how to handle the patients who come into our office. When we brought TMS in, we did a facelift of our practice. We got a new name called the TMS Center of the Hudson Valley. We got new signage. So we have a new sign out front of our building. We have new signage in our office and waiting room, and we have a beautiful TMS suite. And that's been beautifully decorated and designed. And we have a very interesting aspect to the suite because we have our treatment room, but we also have a nursing station that's there as well. And so the nurse practitioner who's working with me can actively be researching and working and answering calls on patients as well as monitoring the patient at the same time. So that was really effective and good planning.
That is great. Cost of TMS.
If I'm talking to a colleague about the cost of TMS, I say that when you are involved with providing TMS, you are not just involved with providing TMS yourself, but you're also involved with Neuronetics. And Neuronetics is the company that made the TMS machine. And they have a wonderful program called NeuroStar Care Connections. And that program has been very effective at trying to fight the fight, which is to get insurance reimbursement and to go through the insurance appeals that you need to go through in order to try to see if you can get the payment paid for. So we've seen already 65 reversals as of now from insurance companies now approving it. So my hope is that in the next future, we're going to see probably within the next year that insurance companies will adopt TMS as a valuable and valid treatment that should be paid for. The next aspect that I usually go into when I speak with physicians is I say, well, what is the cost of not using TMS? And when you don't use TMS, you're using polypharmacy. And as a psychopharmacologist myself, I utilize lots of medications. And each one of those medications has a cost, has a side effect burden, and we have to take that into consideration. And often I am having patients pay thousands of dollars a year on medications in order to treat their depression. So that has to be rolled in as well.
Great.
So when I have a patient that comes into my office and they're thinking about TMS, we start even when they come into the office, because I have a DVD that's going on an ongoing basis that's explaining TMS. So that really has been helpful for our patients. When they come in, they already have seen the procedure as they're anticipating coming into the practice. We also have a website that has a TMS video on it. So they often have reviewed the website and have seen it already. So we've already prepped them in some way by, come take a look at our website before you come in to our office. Now, once they come in, what ends up happening is I will sit down with the patient and I will go over his or her case. And I will give them my best recommendations. And if TMS is the recommendation that I'm recommending for them, what I will do is I will say that TMS is an effective treatment for depression, that it's incredibly tolerable, that the only major side effect that you really have to worry about is a little bit of a headache or scalp sensitivity. That seems to go away very quickly, and we often pre-medicate with a little bit of Advil before they come. That really helps. That they're going to develop a real close relationship with our treatment staff, and that we're going to be working with them on a day-to-day basis to get them well. We're also going to be monitoring their depression, both on a baseline and every week thereafter. And if they're our patient, we're going to have a very, very close relationship, not only with the treatment staff of the TMS, but also our practice staff as well. If you happen to be coming from another practitioner, we send weekly updates to the practitioners so they're aware of what we are doing and how their patient is being treated.
That's neat. Other practitioners.
Absolutely. We want them to know that, we want all the practitioners to know that we are part of their treatment team and they're a part of our treatment team together, and that we're working to help them with their very difficult to treat patients and to try to get them well. If we don't communicate, they're not getting that information. We're also expecting that those doctors that are working with us will be seeing their patients during the time that they're receiving the TMS, so that they can have some input and that they can also talk with us about what they're seeing and if they make any changes with the medications that their patients are receiving. Usually, I'm an upbeat person. I'm an optimistic person. And I am somebody that usually all of us who get involved with TMS are sort of on the cutting edge. And so I am very optimistic about getting people well. So I will be realistic, and I'll say what the clinical trials will say. The clinical trials say 54% of patients in open label studies respond. So that's a good number. And then I'll say that my colleagues across the country who are doing this work have had between 65 and 89% response rates. So I look at it and I say those are really good numbers. And what you're also going to get with us is you're going to get also our recommendations, not only for TMS and how we're going to be giving TMS, but also what might be pharmacologic recommendations as well. So I will come out and say that though those numbers are between 50, 60, or 70% response rates, we're going to try to go for the gold. And going for the gold is getting people completely well. Well, the first important benefit of TMS is that we're going to get you over your depression. That's the first important benefit. The second important benefit is that I often see that patients respond with improvement in cognition and memory, which is often the first set of symptoms that improves with TMS. So I start to see patients waking up a little bit, being more alert, getting more active, more involved. So I see a progression, and that's really what we're seeing is a progression each and every week, getting a little better, getting a little better, getting a little better, until we get people completely well.